Hi dear students, now we are done with NEET PG 2020, and I know in the initial few days after the exam there is that zone of what was the answer to that question, did I mark it, did I read it properly or not, and I thought that let's wait for a few days before we discuss how the paper was and what should a future aspirant think about it. Now, what should we learn from NEET PG 2020 and what are the key take home messages for this? And I would also try to highlight what a future aspirant should learn from this paper. And if you are a future aspirant, do you think this paper has some messages for next exam as well? So let's try to analyze the entire paper and what would be the key take home messages from it. The first and foremost, and I think you already would have heard of it, even if you did not give the paper, your seniors must have told you that this paper had a lengthier paper. This was a more lengthier paper. Classically, when you think of NEET PG, you'll think of things like one-liners, or people will tell you value-based things. In this paper, there was neither of the two. We did not have value-based or one-liner questions. There were questions which were longer stem clinical questions. And as a result of these longer stem questions, the paper, the time taken per question was longer for the candidates, and time management was a critical, component of this paper. If somebody would ask me what was the most important skill that you need to have for such a paper, I would say time management. But what should a future aspirant do when he is looking at this paper? Number one is that whenever we are looking at a longer question, we need to know the skill of looking at a longer question. Longer questions are easier as compared to shorter questions. Why? Because the examiner, when he's telling you a lot, there will be more clues in the question. It becomes actually easier than a one-liner factual question. The only thing is the time. So how do we optimize the time in this paper is, I would give you a few suggestions for a future NEET PG aspirant. Is one is, the classic thing that we all say in our classes is, if you look at a long stem question, look at the last line first, look at the choices, go back to the question. You'll be able to look at the the history in a more objective manner, because you already know what are the four choices and what is it that the last line of the question has asked. Tips like this would help you to do the paper faster when it is a longer stem question. The second thing that I feel is that we should always keep in mind, in such a paper, time management has to be learned beforehand. To do it beforehand, I would always suggest grand tests. And I would always suggest that if you're doing a DAMS grand test, it is a good idea to practice on a, say, a more stiffer time frame. Let me explain to you. Suppose the real exam has a duration of 3.5 hours. So when you are practicing, it's a good idea to put a alarm and say that I will do this. And when you get accustomed to doing 300 question in 2.5 hours, the real exam, you have that luxury of that I have a habit of doing it faster, and you are able to manage it better than if so that the entire idea of doing a more stiffer time management in the grand test is a good idea, and that helps you in the final exam planning. It is something similar to, suppose you are supposed to face a very fast bowling attack in cricket, but you don't have in your own team the bowlers of that pace. So it's a good idea to ask your bowlers to bowl from half pitch, so that you get used to faster bowling. And that is the entire logic that the sportsmen also apply when they have to practice time management. 30 minutes, 50 questions is the key metric to look at. Do not look at the paper as a whole. Every 30 minutes bracket, you should be able to do 50 questions. This should be your mantra for the entire year of practice, so that when you reach the NEET PG exam, you should be well versed with the idea of how to manage time. So, the foremost thing in this paper was time management. But, I've talked to a lot of students. Most of them were able to finish the paper. So, we would put this paper on a lengthier side, but it was not on an impossible side. Most people were able to do the paper. The only issue was that, some of them were not able to revise it, or some of them were not able to look at the questions that they had marked for review. So first thing I wanted to reassure everybody is that if you mark an answer in NEET exam, NEET PG I'm talking about, and you are unable to review it later, they still will count the response that you have marked. And this year the exam body has done a very great gesture by sending emails to students about how many you attempted and how many you left, so that you can cross tally if there is any discrepancy also or not. So I feel that length of the questions, time management was one of the key take homes, and any future aspirant should keep this time planning in mind, because sometimes we forget about it, and by the time you reach the real exam, you know the content, you know the concepts, but you are bad at time management and you suffer in the ranks. So you should keep it at top of the line. The second interesting thing that I wanted to talk about here is that in this exam, now they always have a subject wise distribution, that these many questions will be from part A, part B, part C, which were beautifully followed in the 2019 NEET exam. In 2020 exam, the subject wise distribution was not clear, and reason it was not clear is because many of the questions had that integrated theme to it, that even if the questions were of basic sciences, they had that clinical stem to it, and it was difficult to place that this question is because of this subject or not. They had a lot of integration in the paper. Probably when I say this, I a lot of people today would believe that probably this is a window into what would happen when the next comes, because already when the next is being planned in the couple of next coming years, already people are talking about things like horizontal and vertical integration. People are talking about how to create integrated paper and how to make the question subject independent, like something similar to what happens in the US medical licensing exam, where the questions are more integrated. But some students would be thinking that, is this paper of NEET PG just like USMLE? I would differ. It is not like USMLE. USMLE questions are far more longer, and the style and the topic focus is very different from what is done in the NEET exam. So length is longer, subject wise distribution is not maintained, there is a lot of integration in picture. And when the integration in an exam like this comes, the difference is that if you have done that rote learning or mugging up of questions or one liners, suddenly you have to analyze the question and get to the answer. Some students would have the problem because they have not understood the concept. So if we look at any competitive exam, we are looking at two key skills. One key skill is memory, other is understanding. Here understanding would take a bigger role than memory here. So how to build up this understanding for a future aspirant? I believe that if you're a future aspirant, the most important asset that you can create for yourself is mindful learning in a classroom. Whenever you're in a classroom, you're learning with the teacher, try interacting with the teacher. How do you do this interaction with the teachers is that whenever a question is asked in the class, you try to answer. And you try to, formulate a way of thinking. It is not about knowing the fact, it is about how to think in a question. And that thinking part would have a lot of learning to be done, a lot of concept building to be done in a traditional classroom like environment. I believe that these are the two big things in this exam: integrated question, clinical questions, longer stem questions. But there are like some subtle other information that we can look at when we look at this paper, that they've gone back to those classic papers of medicine, surgery, obs and gynae. While of late we have been seeing, when you came to the AIMS exam and you saw in the AIMS exam the first second prof predominance was there. Here it is clearly visible that the clinical subjects had that predominance in the NEET PG 2020 exam. You had questions on medicine, surgery, obs and gynae. And in medicine also, they had touched upon some classic topics like CNS, endocrine, rheumatology, which of late less numbers were being asked. Now certainly in this exam we see they have asked more of this, more of things like vitamin B12, thyroid. They had a lot of representation in this paper. But I want you to look at two things that I've written here. One is emergency medicine. Emergency medicine had a good representation in NEET PG 2020. It had a good representation in AIMS 2020, and I hope you AIMS 2019 November that was done. And if you notice that I would try to tell you here that we already have a course on emergency medicine on e-medicos, and I think a lot of students appreciated the prediction that we did at DAMS by including such a topic and extensive discussion on this topic on the app, because I believe emergencies would continue to play a big role when next also comes, because most people believe that next should be about what a student should be doing in the clinics and all that kind of stuff. So integration, emergencies would play a big role in next as well. Visual subjects like radiology, particularly radiology, I want to mention here, had a very good representation in NEET, which is different from AIMS exam. In AIMS exam, you had very few questions on radiology. Here, radiology images were in plenty in the PG exam, and I'm very happy to be sharing this as a radiologist here, that radiology is a good building block for any integrated question, and world over, any integrated question is a good idea to put a radiological image, be it Zanker's diverticulum or intussusception, and it's a good idea to put a radiology image in the paper. Dermatology also visually was there in the exam. So the paper had a good visual component, a good clinical component. Classic clinical subjects had more value than a basic sciences subject, but there was more integration into the picture, and we saw all those short subjects being more important again, like radiology, dermatology, and they had, so all this kind of builds up the paper for you. But what you would hear around will be that, sir, there were some unusual questions, like there was Popeye sign or Mickey Mouse sign or Monica sign. There are some unusual things in the paper. There are, but I want to tell here is, suppose you do not know them in the paper, it is not a point to panic about. Sometimes such things are there in a paper and many people do not know it, so they usually do not make a difference in the final rank. The ranks, the selection is usually determined by the bulk of the question, and in this paper the bulk of the questions were conceptual, doable paper. So if you have done those classic things right, and if you do not know some unusual questions in the paper, that's okay. That should not make a much of a difference in your final rank. There are questions like this in the exams, and that has been a part and parcel of the Indian PG entrance exam in the last 2 decades. There are sometimes such questions in the paper, but you know them, it's good. If you don't know them, and you have to be assured that most people would not know unusual signs, so they're not really that important as compared to classic things, classic concepts that you should be knowing, and you do them wrong, you will suffer more. Let's discuss about that in a while. Another thing I wanted to add is that most people came back and had the opinion that instead of accumulating more and more things, it is always better to trust what you have. And for most Damsonians that I've talked to, most Dam students that I talked to, had an opinion that it was a good idea to revise the class notes that they have made with their own hands, and so that consolidation of concepts towards the end would help in such a paper more than accumulating more and more data. Now, again, you have to understand, at postgraduate level, I'm trying to give a concept here is, whenever we are in school, so in school, in the class first and class second and class third, you accumulate more and more information, and we start believing that more information accumulation will help me in the exam, while in such an exam like this exam, you have to apply what you know. So I want to point out to you a key word here, which is revision of notes. Revision of what you have done in the year should be your last month strategy, and this message was very loud and clear with this exam. Revision was the key to this paper. And there would be thoughts in your mind, like classic students questions are, what is the safe zone? Now, I don't believe in those prediction games or those gambling games, because every exam, after the exam is done, where the questions are recalled, they are not shared by the exam body, so there is no clear cut key available, and everything is a speculation here. But if we look at this paper and I look at the entire database and I see what people have done, and we've talked to many students, I believe around 320 should be the 50th percentile, which is the qualifying mark in this paper. So it should be around 320 should be the score for qualifying here. And we can always look at the path above that and find out of 1200, I believe 320 should be the qualifying mark approximately, because that has been the ratio in the last two NEET exam. If the paper is slightly easier, it goes up to 340, slightly difficult, it goes to 320, and that is the play that usually is there. Now there would be, things like this in my inbox these days. A student would say, sir, I have made some silly mistakes. Some silly mistakes everybody would make. You have to be kind to yourself. The paper is already done. You have submitted the paper. Don't have that, over traumatization of yourself is not fair. It's not fair to tell yourself that you have made silly mistake. I believe everybody makes some silly mistakes in such competitive exams. You have to be kind to yourself once the paper is submitted. And another good thing about this paper was, because this paper was not about rote learning, it was about applying, about concepts. One or two silly mistakes will not cost you as much as they would do in a more easier, more direct paper, where everything is easy to do and you do some mistakes and you're out of the game. In this paper, even if you made one or two silly mistakes, it should not matter. And this feeling you might be, I see a lot of students saying, messaging, sir, I have not done my best. It is okay. You've done what you could. And so you have to utilize this time to look at now what further. So if you were not able to revise, you were not able to see mark for review, all those things might happen in a longer paper, which was the case in this exam. But you have to know, if a paper is long, it is long for everybody. If a paper, if a exam requires application analysis, it is for everybody. So anything, any factor, if a length of paper is long but it is long for everybody, it nullifies. And then probably it is better for the candidates. If a paper is more longer, more application based, it favors the students who have worked hard. Because on the other hand, make a paper which is more direct, one line, straightforward, then only the silly mistakes will become the determinant. In this paper, I believe there was a lot of concrete element in the paper to find out and create a merit list out of it. So it was a good discriminatory paper to say in one line and summarize what the paper was all about. So if you are a future aspirant of NEET 2021, and especially, and you're looking at a next in the couple of years, we believe that integration would be a big buzzword in the exams. And I've done this, I've talked about this in multiple videos. You can actually scroll back in the YouTube channel to see. It is all about horizontal and vertical integration nowadays. Horizontal integration means when we integrate subjects in the same prof. Vertical means when we integrate subjects in different profs. For example, if we have a surgery question integrated with radiology, it is a horizontal integration. If we have an anatomy question integrated to radiology, it becomes a vertical integration. So this would be the theme going forward. Another thing that comes out of this paper is, let's not stick to rote learning. Let's not have that prejudice that NEET exam would be about one-liners. Let's not have that prejudice that NEET exam will be more factual. Let's look at building concepts. People who will build a concept, understand things, spend time, understand it, clear your concepts, that would have the maximum impact in future towards your doing well in the exam. Another thing I want to point out here is that instead of going towards guidebooks in the final years that you have, and you will see a lot of toppers would also advise you the same. Instead of going towards guidebooks and MCQ banks in your third year and fourth year, it would be a good idea to understand the concept and also do your ward postings also. This is something which has come out recently in most of the exams. It's a good idea to mindfully attend your ward postings. And in DAMS we have taken an initiative of including practical courses also in your app now. You will have medicine practical course, surgery practical course. Dr. Arvind has taken an initiative to do the medicine course. There is a excellent surgery course with patient encounters, how to examine thyroid, how to examine breast lump. We have created all those things in the app for you. And because we believe he will continue to contribute some questions in the exam. We saw this in AIMS, we saw this in NEET, we saw this in PGI. So this is the kind of updation that we've already planned and we have implemented for medicine and surgery already. This medicine and surgery practical course will be available not only to foundation students. This year we will be giving this course to the regular students also, so that they also have this advantage. Suppose you are from a peripheral medical college where the clinical exposure is not good. So these videos that we have created with the best of the best people would help you to fill up those gaps in your internship. So this is one of the things that I wanted to point out. Another thing I want to point out to you is something that I've learned in my life, that every time in our life we are doing something, we have something to do. Like, before every day you had some target, some paper to do, some topics to cover. Now you have a pause with you. The pause is a scenario where you have given the exam and the results are yet to come. You have nothing to do right now. You are in a pause scenario. Whenever you are in a pause scenario, please utilize the pause to introspect. And to introspect means to find out what you really want. And you have to differentiate what you want out of life from what people are telling you to do. Now, the idea is that, whenever we see around, we see people, sometimes children will come and say, sir, my friend who was with me in the school, he is already enjoying. I saw his photo on the Facebook. He is doing some, vacation, and here I am being a doctor, I'm studying. But you have to understand, nobody would put, everybody would try to showcase their fun moments on social media, not their, the low moments. So it's like you have to get away from that comparison and you have to get back to what you want from life. And when you made this decision of becoming a doctor, you wanted more out of life, you wanted a bigger impact, and you decided to come towards medical profession. Find what you really want and utilize the pause to introspect, and then also utilize this pause to look at opportunities. Now, if you look at the sequence of events, now in the due course, by this month's end, you will have the results with you. Then in March, you will have the NIMHANS exam. In March and April, have those NEET counselings happening, and in May you will have the AIMS exam, and after that in May itself there will be NEET joining also happening. So many students, what they will use is they will utilize this period in between to prepare for central institutes like NIMHANS. NIMHANS has 3 sets of paper, where the common paper is of 70 marks, where 70 questions of all subjects are asked, and 30 questions of neurology, neurosurgery, psychiatry respectively, for depending on the specialty that you have opted for. That means if you have opted for neurosurgery, those 30 questions will be primarily from neurosurgery. And considering this, in DAMS we have created 3 different courses for you on the eMedicos app, for neurosurgery, for neurology and psychiatry separately. Some of the students will now start thinking about mid-year AIMS exam. And I would suggest that the AIMS TND that we have started recently, which is available now on all 3 media, face-to-face, satellite, app, is a good idea to synchronize your study. 3 quick messages for people who are going to prepare for AIMS exam mid-year. Number 1, synchronize your study to the TND schedule. Do not wait for the result, because if you wait for the NEET result to prepare for AIMS, 1 precious month will be gone. Target first week of April, finish your syllabus by first week of April, so that you have 1 month to revise before the AIMS exam. Do not forget to look at last 3 paper. November 2019 solution will shortly be uploaded on eMedicos app for you. Don't worry about that. But do not forget to look at last 3 years AIMS paper for the AIMS exam. Do not forget to look at those modules that I pointed out in my previous videos on emergency medicine, which is a very important part of AIMS. Very, very important. AIMS capsule will continue to remain important for this AIMS exam as well. Last year in the AIMS exam, you did not have too much biostatistics in the paper, but before that there were. So you can't miss out on PSM. as a whole for AIMS exam. Obs and Gynae continues to be a very important part of AIMS emergency medicine. First, second prof subjects have good value in AIMS as compared to the other exams. So you have to keep all those things in your mind when you are preparing for the exam. There is a shift now I see in surgery as well, that a good detail of systemic surgery is being asked in all exams including AIMS and NEET. It is no longer just general surgery in the paper. So you have to keep these things in mind, but the idea is about how you utilize this time that is left. But I also want to tell you here, it is not necessary to do anything that others are doing. It is up to you. You have to find out what do I want from my life, and then make a plan, prioritize, and then seek mentors. Ad dams will always try to help you to achieve your goals, but you need to find that you want to do it first. So that kind of introspection should be the priority in this pause. I am not denying that you should always utilize the pause to enjoy or do something that you were always wanting to do but you never got time to do. That is, again, definitely goes without saying. But when you seek out advice from me, you seek out advice for your career. You know that for knowing about which TV serial to watch or which movie to watch, you have so many people to advise you on. So I'll not go on to that direction, but I want you to utilize this pause to the best of your ability. Find what you want in life, do things that you always wanted to do, and also look at the opportunities which will be coming to you in forms of exams. Because to me, exams are like opportunity for a candidate where he can do his neurology DM in NIMHANS, or do neurosurgery in NIMHANS, or target the mid-year AIMS exam where the number of candidates appearing for the exam will be lower. So I hope in the mid-year the number of candidates are lower, and big difference is November AIMS exam is more focused towards internship oriented things. May is more focused, slightly more theory is there in the May exam. That is a slight difference between the November and the May exam, which you can also analyze by looking at the previous papers. So please utilize the time that you have in knowing what you are doing. Now, a lot of times people confuse having fun with changing channels on TV or Netflix. So many times I felt it myself also, that when sometimes you feel that okay, I want to watch a Netflix or something, but all I end up doing is changing the channels and see, and in the end I end up after 1 hour seeing nothing. So I actually don't put my time into it. You need to find what you want to do. Introspection is a good idea at this point. It is about what you want out of life. It is not about pleasing others. It is not about what others would want you to do and conforming to people. It's about what you want out of life. And in today's scenario, I also want to bring to your notice, because we have some time today, you're after the exams, we are discussing that no longer is the world defined by those classic ideas ke itne saal tak I will study and after that I will work and I will not study. It's no longer, the border is so blurred. Medicine education is evolving so fast that it is always about a continuous lifelong learning that you're looking at, and you have to keep that learner spirit, that mindset that we talk about in all of our classes, about being a learner, being happy to learn, being excited about learning new things, should always stay with you, because that attitude will take you further than anything else. And I also want you to know that any exam, any result will not change the person that you are. You are already a special person. You're already a doctor. So don't get overwhelmed by the result. You are a special person. You are a doctor already. So keep it in mind that what you have cannot be taken away by an exam. Exam is one of the challenges that you face. Some challenges you do well in life, some challenges you don't do well in them, but you always learn. And the true winners in life are people who will keep learning from mistakes and keep doing better and better in the coming challenges. So that should be the mindset that I would want you to have now. And I would definitely want to wish all of you best of luck for your results. And I would also like to wish the best to the future aspirants who are listening to me today, because they wanted to know how the paper was and what are the implications for future aspirants. And I'm keeping my fingers crossed for each one of you. And I really, really wish that you get the branch of your choice in place of your choice. I wish you all the best.